Hypertrophic cardiomyopathy, HCM, is a disease in which the heart muscle becomes thickened, hypertrophied. The thickened heart muscle can make it harder for the heart to pump blood. Hypertrophic cardiomyopathy often goes undiagnosed because many people with the disease have few, if any, symptoms. However, in a small number of people with HCM, the thickened heart muscle can cause shortness of breath, chest pain, or changes in the heart's electrical system, resulting in life-threatening irregular heart rhythms, arrhythmias, or sudden death. Causes and risk factors for hypertrophic cardiomyopathy. HCM is an inherited condition, a condition that is passed on through families. There's a 50%, 1 in 2, chance that the children of a parent with hypertrophic cardiomyopathy will also have inherited the risk of developing the disease. If you have HCM, your first-degree relatives, parents, brothers, sisters, or children may want to consider screening for the condition. Symptoms. Signs and symptoms of hypertrophic cardiomyopathy might include one or more of the following: chest pain, especially during exercise; fainting, especially during or just after exercise or exertion; heart murmur, which a healthcare provider might detect while listening to the heart; sensation of fast, fluttering or pounding heartbeats, palpitations; shortness of breath, especially during exercise. Treatments for hypertrophic cardiomyopathy. The treatment for hypertrophic cardiomyopathy, HCM, depends on the severity of the muscle thickening in your heart, the presence or absence of outflow tract obstruction, and what your care team determines your risks to be. The majority of patients with no symptoms and with a normal heart rhythm require no specific treatment. However, we recommend that patients with HCM not participate in strenuous physical activity or competitive sports.